Well, thank you so much, David, and thank all of you for listening and for watching. I'm Kim Harms. I'm a dentist. I've been a practicing dentist for over 35 years. I have also been around the block many times when it comes to emotional issues. I've suffered a number of losses in my life, including the loss of a child, which is one of the reasons that I'm here today to talk about emotional issues in this global pandemic that we're experiencing. And I served for 21 years as a spokesperson for the American Dental Association. So I was around back in the time when the AIDS epidemic was hitting, and we had to try to figure out what we were going to do when we were dealing with bloodborne pathogens. And so now we're dealing with respiratory pathogens, and all the work we did with the AIDS epidemic is certainly helping us. But we now have to redo our thinking in a number of areas to protect ourselves and our patients against this very, very transmissible respiratory disease. So we're going to talk today about, of course, the coronavirus, the global pandemic that has turned our lives upside down. And this is not just a crisis for us, it's a crisis for the entire world. And it really is considered a catastrophic loss because we have lost our way of doing things, our way of doing business, our way of relating to our patients. And many of us are going to have to go through a time of grieving and a time of learning how to mourn this loss and move ahead and change what we're doing. And there are a lot of emotional issues that are going to be increased right now. And we're seeing this all across the globe. We're seeing increases in suicide, problems, increases in mental health, increases in violence all over the world. And how do we deal with this? So, as doctors, most of us believe, or at least we hope, that emotional emergencies in our offices will just take care of themselves. And I completely disagree. I believe that we have to treat emotional management as part of our standard of care. And here's why. Managing emotional issues in our office and managing our basic emergencies that show up, because there are many emotional emergencies that show up in our office, improves treatment outcomes. It improves and strengthens patient loyalty. It increases staff retention, and it also amplifies our production. Not only am I a dentist, but I was a patient in several hospitals over the last 6 weeks or so. I spent over 2 weeks in a hospital, and several hospitals, actually in three. And I was in the COVID ward. I actually had a COVID imposter virus that had all of the symptoms of COVID, but of course, none of the immunity. So it's like the worst thing for me to have. And during that time, I was able to react and interact with a lot of healthcare providers, a lot of the doctors and nurses, the respiratory people that came into my room and interacted with me. And about half the time, they thought I was a COVID patient. But when my COVID test came back, then I went into the non-COVID area. And I can tell you from firsthand experience that I witnessed anger, I witnessed fear, I witnessed uncertainty. I had one nurse come and say, I feel like we are operating a plane and we don't have a pilot. So there is a lot of emotional issues, there are a lot of them out there in the healthcare industry. And we need to keep those under control and learn how to manage them. We're going to be giving you a lot of additional materials today that I would like for you to look at. There's a special article in the little book, the Emotional Emergency Handbook, that's called The Secret Life of Grief. And that might be something to really take a look at if you're struggling with grief, because we as healthcare providers have to put a smile on our face and be confident and go to our patients and act as if nothing's wrong, even when we are falling apart on the inside. So this is really an important issue to address and to manage right now. Now, my daughter Hillary is going to be talking to you a little bit about one of the other issues that is going to cause emotional stress, and those are the legal considerations post-COVID. So I'm going to turn this over to Hillary.
Hi, thank you, Mom. So I'm Hillary Bichetti. I am an attorney. I have a license in Minnesota, Wisconsin, and South Dakota, but I'm based in Minnesota. As David so nicely introduced me, I am essentially a dental attorney. I about 99% of my clients are dentists, but I also represent some small practice owners and other medical professionals like optometry, chiropractors, sometimes veterinarians. So this is essentially what I do all day, every day. And COVID has presented a unique challenge in that, like my mom stated, we're operating a plane without a pilot. And in the legal world, we're essentially doing law in real time, which just never happens. Usually we have months or years to look over new legislation, and suddenly we're getting bombarded with multiple huge legislations that have, an enormous effect on my clients as medical providers, small businesses mainly. So we've had to really navigate this situation. And of course, this is an ongoing situation. So my presentation, is up to date as of today. But, as I'm going to say my legal disclaimer, consult your local attorney on the local laws. I'm going to go over the federal laws just because it's a national webinar, but every state is doing this completely different for the most part. So there could be certain nuances or things that you need to really look to your local attorney for, or local executive orders. So definitely talk to your local attorney. But I wanted to give a general overview of some of the larger national legislations that's been going on that can maybe help you with your small practice, or if you have a little bit larger group practice as well. So I've been dealing with my poor clients. I've just been feeling so bad for them. Having everything shut down has been really, really tough. And, going back to the emotional emergency piece, I really feel like they're all going through those stages of grief right now. I've had clients cry on the phone. I've had clients get angry. I've had clients, deny that everything's going on. And now we're finally in that acceptance period. And now we're starting to move forward into reopening. And so with everything reopening now, there's all this new legislation that have come into place. And we really need to, kind of muddle through it as best as we can. But I can tell you just from my own experience with my clients, there's a lot of concerns for reopening. And so far, these have been the top 3 concerns that we've had. Probably the number one is employees not returning. The nice little $600 boost for unemployment insurance was wonderful, but now it's having sort of the opposite effect in that, before pre-COVID, you got unemployment insurance. It's usually a fraction of your pay. And with that CARES Act, everybody that's on unemployment got a $600 boost, which means that a lot of employees are now making more on unemployment than they would if they were working. So that's been kind of an underlying issue with employees not really wanting to come back because they really are making more money on unemployment. And of course they get to stay home. But there's other reasons why employees are having a really hard time returning, especially in the healthcare, is that there is a higher risk for COVID exposure. Dentists, especially hygienists, are at almost just as much of an increased risk to be exposed to COVID as nurses and doctors that are actually treated COVID patients. So simply because they kick up a lot of aerosols in the air from cleaning teeth, that kind of stays in the air for a little while. And so they're having a really hard time, rationalizing coming back, thinking that, I might be at a higher risk than most people. And a lot of people are really scared. Childcare is also a big issue, and we'll kind of get into that later as well. PPE shortages. We've all heard it all over the news. PPE is in really low supply, especially N95 masks. And if you're in healthcare with the new CDC guidelines, which we'll go over later, almost every healthcare provider, most healthcare providers are having to, be required to wear those, and they can't find them. And then of course, trying to muddle through all the new CDC, OSHA board, local governor's orders. I feel like it changes almost every day, which is kind of crazy. But just keeping up with all these CDC and OSHA and board guidelines. Luckily, at least I know in Minnesota, our board, our local dental association, has been fantastic with updating our members, updating, licensors, with these new guidelines, kind of keeping them up to date. So hopefully if you are a member of your local association or your board, they've been kind of keeping you up to date, which hopefully that's what they're doing. But pay attention to those, and hopefully you can kind of keep it up. So again, going back to the reasons why employees not wanting to go to work, we discussed the unemployment boost, but other reasons too are, they're just scared of COVID, and there is a real fear out there. People haven't been leaving their homes, let alone wanting to go to work in a healthcare setting where they're going to be at a higher risk. One of the number one reasons I've been getting from clients whose employees don't want to go to work is that their employees have a risk factor, which could be anything from over the age of 50, diabetes, overweight, a certain race or ethnicity. We've been finding those have been at a higher risk for some reason. So there's a really, a scare factor there, and that people with, especially older people, are having, are really, really scared to go back, because they're scared to get COVID, and they're scared to, possibly get sick and be one of the fatalities. So, and that goes towards the unsafe environment as well. A lot of them are, some practice owners aren't taking this as seriously as they probably should. And so employees are looking at that and they're saying, well, I'm already scared enough to get COVID, even if I have all the, proper PPE and the sterilization procedures and the HEPA filters and all these other things that they're doing to kind of lower the risk. But then now my employer is not taking this seriously, maybe not doing all the things they're supposed to be doing. So those are some of the reasons why they're just not wanting to go. Also, childcare and school closures. School closures, now that we're getting into the summer months, isn't as much of a priority, but a lot of daycare providers have shut down, or they've suspended their centers, or a lot of parents are scared to send their kids to daycare because it's a school setting. They're going to be exposed to other children who might then expose them to COVID. So a lot of different reasons why people are really just not wanting to go back to work. So what do you do when your employee doesn't want to come back to work? The answer really depends on why. And before we get into that, 'cause we'll go into the risk factors a little bit later, but a lot of times, employers will look at their employees and they'll say, well, hey, I really do want to protect you. I want to kind of overdo this. I want to make sure that I'm, taking care of everybody. I'm not going to let anyone who I think might be at risk. But when you do that, so for example, you might have an employee that's pregnant, and you're thinking, well, I don't want her to sit in a chair. I want her to sit at the front desk, or I want her, somewhere else where she's not exposed because I want to protect her. Or maybe you have someone of a different ethnicity that is at a higher risk for COVID, and you say, well, you know what? I don't want to put you at risk. I'm going to do you a favor, and I'm going to put you somewhere else. Well, you got to be careful when you do something like that because of Title VII. So it's the Civil Rights Act, employment discrimination. And it basically says you can't discriminate based on race or gender, ethnicity, sex, I guess goes to gender, or culture, religion. And you have to be really, really careful that you are not demoting or taking adverse action towards an employee because of those reasons. And even though you may have good intentions, you may say, well, you're pregnant. I really want to protect you and your baby. And you move them somewhere else. They might see that as a demotion. They may see that as an adverse action, and you're kind of running into that muddied water of discrimination. So the solution to that is, let them approach you. If you're worried about your pregnant employee and you want to say, I don't want you around patients, I want to put you somewhere else, kind of out of harm's way, let them approach you and have that concern. Or maybe sit down and talk with them and say, listen, how are you feeling? What do you want to do? I realize, you're pregnant, and I just want to make you feel safe. And let them decide that. Don't ever pressure them. Just let them decide that. And then, if they do say something like, well, yeah, I would prefer to be up, up front. I prefer to, just move to a different area in the clinic. Then you can go ahead and do what they want to do. Now, the biggest thing I've been getting are people with risk factors. So employees that have risk factors, they don't want to return to work because they're, maybe they're in their 60s, or I get diabetes a lot. And they say, I don't want to come back because I have diabetes and I'm at a higher risk. And they kind of pull this Americans with Disabilities Act, and they say, well, you should make reasonable accommodations for me. I shouldn't have to come back to work. Well, Americans with Disabilities Act does apply to people who have disabilities. So diabetes would be considered a disability. Age would obviously go into the discrimination piece, but when it comes to risk factors, a lot of governors and local governments have attributed age as a risk factor. So therefore, it kind of falls into this Americans with Disabilities Act piece. So you want to make sure, so employees come to you saying, I have a risk factor, I shouldn't have to come into work. Well, your only obligation as an employer is to make reasonable accommodations. And those reasonable accommodations cannot be an undue burden on you. So if you are a small practice and you only have 3 assistants and 2 hygienists, and having that one person, or maybe 2 or 3, because maybe 3 of your employees have diabetes, not come in, well, that would be unreasonable. That would create an undue burden on your business. And it doesn't fall under that category. So the point being is that them not coming into work is not a reasonable accommodation. A reasonable accommodation would be, okay, maybe we switch you to front desk. Or maybe, we'll give you more PPE. We'll give you the high tech. We'll give you everything you can possibly get. We can basically cover you from head to toe in PPE to really reduce your risk factor. In pre-COVID, the example they always say is if you have a back problem, you get an ergonomic chair. But if it gets to the point where it completely affects your business, and there's just no way that you can reschedule this person. So a good example would be a hygienist. A hygienist can't sit at the front desk. Their job is to do hygiene, to clean teeth. An assistant, maybe. Assistants can go from front to back. Or maybe a nurse, you need that nurse treating the patient. You don't have room, or you don't have any kind of area where they can go, where they could just be at a front desk, or not even, come into contact with people. It just doesn't work. That wouldn't be a reasonable accommodation. So you don't have to do that. So they do have to come in. You have to make some reasonable accommodations, but if it's such an undue burden, there's nothing you can do. I mean, they still have to come in. There's no recourse that they can take against you. Also keep in mind that Americans with Disabilities Act only applies for employers with 15 or more employees. So if you're a really, really small practice, you only have 5 employees, this technically doesn't apply to you. However, make sure you look at your local laws because some local states expand the Americans with Disability with local statutes. So we're going to move on to the FMLA. So the new legislation is the FFCRA, which is the Families First Coronavirus Response Act. And that actually essentially expands FMLA. So I wanted to go over this first so you get a little bit of a good idea. Most people know what FMLA is, but some of you that are, that work for smaller employers, maybe you don't know it as well. So I wanted to go over this first to explain this because it really, really becomes important when we discuss the FFCRA. So Families with Medical Leaves Act, most people know this is maternity leave. If you have 50 or more employees, you have to allow for the FMLA leave, which essentially is 12 weeks unpaid leave for pregnancy, if you're sick, if you're taking care of someone that's sick. And again, most people know this as maternity leave policies. It's 12 weeks unpaid leave, but most small practices never have to deal with this because it doesn't apply to them. So people with 50 or less employees have never had to deal with this. Well, now the FFCRA completely changed this and essentially expanded FMLA leave to employers with 500 or less employees, which includes people who have 50 or less employees. So that includes pretty much everyone from mid to small businesses. So there's 3 reasons why an employee would be able to get this FMLA leave. The first one being if they have COVID or COVID-like symptoms and they're seeking a medical diagnosis, which if you're in a medical setting, you're probably not going to want them to come into work anyways. So this one, is kind of understandable. The only change is that they're provided with 2 weeks paid leave, which they can use some of their PTO leave. And they just made that adjustment a few weeks ago where the employer can require the employee to use some of their PTO for this paid leave. But keep in mind, again, if someone has COVID-like symptoms in healthcare setting, you're probably not going to want them there anyways. So not as big of a deal, but again, something you need to think of. And it does apply for people who have 50 or less employees. The second reason is for essentially just like the first, they get up to 12 weeks unpaid leave, 2 of which are paid if they're taking care of someone with COVID or COVID-like symptoms, which again, if you have someone in their household, they're being exposed to COVID, you're probably not going to want them in their clinic anyway. So probably a good precautionary measure anyways, but just keep in mind, this is something that you are now required to do as a small business owner or small medical practice. The third reason, which is the one that really was tough to swallow when it first came out, but now there are some exemptions, which I'll go into a little bit later. But the third reason is FMLA leave got expanded to 12 weeks unpaid leave, 10 of which are paid if you have an employee that has to stay home because their child's school closed or their child care center is closed, which of course pretty much applied to half the country. So it really it was tough to kind of think about that, because especially small business owners, they're closed, and now they're going to have to, once they reopen again, they may have to, be required to pay their employees up to 10 weeks paid leave. So luckily the Department of Labor clarified this and made an exemption for the third reason. So for the school closures, employee leave for school closures or childcare center closures has now been, you can now get exempt if you have 50 or less employees. You can now be exempt from this if you deny the leave for the 3 reasons that I listed in my slide. Essentially, you can't afford it. So the financial obligations would, exceed the need for this. The absence of the employee would just be a detriment to your business. Or you can't find enough workers to cover for that person, which in today's time, it would be pretty hard, especially I know in the dental world, we've had staff shortages for quite some time. So this would be a really hard, a big hardship for most small practices. And, you probably could find at least one of the reasons on there to make that exemption. The only thing you have to do for that exemption is essentially record that the employee made that request, you denied that request, and the reason you denied that request. Document it, write it down, and then file it away for 4 years. You don't have to do anything beyond that. You don't have to, file anything with the Department of Labor. They just want you to keep a record so that if they somehow it comes back to you or they audit you, you can say, yep, nope, here it is. I, recorded it. They made the request. I recorded it. I denied it for this reason. We're good to go. So the other reasons, the other concerns people are having with reopening is PPE. I think that's, an issue across the whole medical field right now. In regards to what PPE you are required to have, refer to your CDC guidelines. Every profession, almost every medical profession has their own little page on the CDC of what they have to do, dentists, optometrists. Follow that as best as you can. Luckily, the CDC offers a lot of alternatives because they realize that there are shortages. For instance, in dental, if you can't find N95 masks, you can wear a level 3 surgical mask with face shields. If you can't find gowns, jackets that you change, with each patient will be fine. So look at those alternatives. Look at, get creative. I have clients that are sewing gowns for their office that they can, obviously reusable ones that they can wash. Do the best you can with what you have, because this will probably go on for quite a while. Watch out for the scams. There's so many scams out there right now, especially with the N95s. The FDA had a list of Chinese factories that produce KN95 masks. And I think about 2 weeks ago, that list of 60 whittled down to 14. So I had a lot of clients that had ordered through a reputable supply company from a factory in China that ended up getting taken off that list. So look at the FDA list of, approved factories. Make sure you're buying from a reputable and a trusted supplier. Don't buy them off of, Facebook. There's a lot of things out there that you just really got to be careful. So make sure hopefully you have a trusted supply rep that can help you out and get you those supplies. So the CDC guidelines. So this is like the worst slide ever, I realize, but because things are changing so quickly, I get this question a lot of, well, hey, OSHA, is saying this, CDC is saying this, my local board is saying this, the governor is saying this. Who do I listen to? What do I do? So for the most part right now, OSHA is essentially referring to CDC. And then CDC has their guidelines, but they also are deferring to local boards and local governments. So look at your local board and your local government rules and guidelines first. If they refer to the CDC, which in most cases that I've seen, they have their guidelines for reopening, they have, their plans. And then there's a few places there they say, okay, we'll refer to CDC for PPE requirements, something like that. So start with your board, start with your local government, and then kind of move up. And make sure you look at the CDC guidelines. I get a lot of questions of, well, what am I supposed to do with this? I'm like, it's right there. The CDC literally has a list of how you're supposed to do things. So they really are doing the best they can in keeping us updated, and keep updating yourself with it too. Look at it weekly. I've seen it change in the last month at least twice. I have a feeling that as things reopen and we kind of go up and down this roller coaster, it's going to keep on changing. So I'm going to turn this over to Mom, and she's going to let you know how to implement all this, how to keep yourself safe, and go on from there. Yeah.
So thank you, Hillary. So now we're going to talk about the new normal at the office. And we just heard all of the legal issues. Let's talk about what we have to do to prepare our offices for our patients post-COVID. There are three basic things we have to look at in our offices. First of all, we have to look at the engineering controls, and those are basically the physical isolations. Engineering controls basically physically isolate the patient, basically is who we're talking about, to protect the team members from the patient. So you physically isolate the hazard, and of course the hazard, I hate to say, is now is anybody that might have COVID. And of course we have to consider, just like we did with the AIDS epidemic, that everybody has COVID to a degree as we're working them through our offices. We can't tell who does and who doesn't have it. The second controls we have to work with are the practice controls, the work practice controls, which are the hand washing, the treatment room protocols, changing your clothing, your room management, things that we do to protect ourselves and our patients from contracting a respiratory illness. And then the third thing is a personal protective equipment. Now, it's really important that Hillary went over that a little bit. And the good news is that many of the PPEs are starting to get a little more available to us. So that's the good news that we're hearing. And after the AIDS epidemic, I think it's important to remember many of the things. I'm a dentist, and during the AIDS epidemic, we were terrified because we now had to autoclave our handpieces, and our handpieces weren't meant to be autoclaved. They were meant to go in cold sterilization. And we thought, oh my gosh, we're going to have to buy new handpieces every week because they're not going to be sterilized. It's important to know that the natural way things happen is that technology will change and adjust to these new realities. And we're already seeing technology changing and adjusting as we see the new PPEs coming around. So I think we're starting to see some changes that are good ones. So I know it's a little terrifying right now to think that we might not be able to get the personal protective equipment, but it's coming. So we need to prepare before the patient visit. Patients are terrified out there and they're nervous, and they need to know that they're safe and that we're keeping them safe. So before the patient even comes in, it's important for you to communicate with them that, hey, we're open, we're welcoming you back. If you have elective procedures that need to be done, we're ready to see you. We are using all of the appropriate protections for you. Come on back. They need to be welcomed back because they're scared. They're terrified that they're going to get a deadly disease if they walk into your office. So you need to show them that you're doing everything you can to prevent that from happening. And you also have to prepare your staff and your team by going through the disinfection procedures and learning how to schedule your patients, because you're not going to be able to schedule them the same way you did before. And the CDC has all the guidelines. So I'm really going to recommend, like Hillary, you go to the CDC website because they change daily. There were just some new changes that I saw today that the ADA announced. So I had to redo some slides because some new things came out. So check with the CDC. The American Dental Association has great websites. I'm sure the American Medical Association has those as well. But stay up to date and practice with your team. Find out how long it's going to be between procedures and then schedule your patients accordingly. It's very unlikely you're going to be able to schedule your patients now the way that you did before. And when we talk about some of the things we have to work through, is that we have to work through a new expectations of patient scheduling, because we're going to have to adjust to whatever the current protocols are. Hopefully, if the vaccine comes out, we'll see some other protocols maybe changing or lightening up a little bit. But right now, we have to stick with these protocols that the CDC recommends. And it's also important to make sure you develop written guidelines for what you do when a team member, staff member, or a patient shows signs of illness, COVID especially. We need to make sure you don't have to, if a patient is showing some signs of COVID, if they have elective procedure, it'd probably be a good idea to put that off for a while. And if it's something that's an emergency, then you'd have to make sure that they can be seen in an environment that protects everybody and they can be seen. So have those guidelines written. And again, there are many agencies and organizations that will help you do that. So what do we have to do? Let's go step by step through the patient visit. Now we have a new patient visit. The first step is we have to train our staff, and they have to be confident and welcoming. And I will tell you again, when I have had my experiences lately where, we were talking about the plane without a pilot, which I think is my favorite quote. I went to had a doctor's appointment today, and everybody in that office was welcoming, and they smiled at me, and they were perfectly confident. We are going to get you through this, and we've got everything under control. That's what patients need to hear. So make sure your entire team does that. If you've got someone that's not on board, we need to get that person on board, because that's going to affect your entire business. You need to thank people. Make sure that you thank your patients beforehand. And one of the best ways you could do that is to have some sort of a teledentistry, telemedicine, a call, which does not have to be by the doctor. It can be by a nurse or somebody at the front, letting them know what you're doing, asking them if they have any particular problems. You can use telemedicine, teledentistry in particular, as a triage method. If there's somebody's calling up and they might have a situation that does not really require a patient visit, does not really require that they come into the office, it certainly is an effective thing to do than to try to manage that on the phone. And so teledentistry, telemedicine is getting bigger. I think I've had 3 or 4 appointments already using telemedicine on the phone. And dentistry is a little hard. You can't really do dentistry on the phone, but you certainly can triage people. You can kind of give them some ideas, and then when they do come in, you'll have a better idea of knowing how to schedule them. You need to prepare for them. You need to prepare them for their new reception area. Is your new reception area in the car with the phone? Is that how, are we going to wait in the car? In some areas, you might have to do that. Or are you going to wait in a reception area with the chairs spread out a little bit so that there's some social distancing, and ask them to wear a mask? Make sure they know that before they come in. The more they know before they come in, the better. They're not going to be surprised. People are afraid already, and sometimes any surprises you have when they come in could make them even more anxious. We need to communicate. And I think, again, this is a recurring theme you might have noticed, but communicate. Let them know what they need to do, that they shouldn't bring their 5 children when they come to their appointment, that you need to be able to limit the people that are in the room. And also, if they have an illness, if they're sick, then you're going to need to reschedule them, or wait till they can come back when they're healthy. They need to know that beforehand. It's so much better for them to know that at home than to find that out when they walk into your door, because there are enough changes going on at that point. Greeting the patient also is absolutely it's crucial to know how to greet them, and we need to be happy when we're greeting the patient. Sometimes the staff members at the front are anxious, or they're worried about what's going on, and it shows on their face. You can't do that. You have to be confident. You have to be happy. You have to, you can explain the barriers, let them know what's going on. Use a little bit of humor. Smile behind the mask as much as possible, and also let them see that you are absolutely focused on their health and safety, and that you're doing everything you can, and show them. Patients are watching. Make sure that they're welcomed back. Again, that goes the whole greeting session, and we're committed to putting your health and safety as our number one priority. Absolutely, they need to know that you are there for them. You got their back. You are their partner in health, and so bring them in and make sure that they know they're welcome, and also make sure that they know, either through telling them or through having a sign posted, that you follow all of the latest guidelines for infection control, because they will be looking. Also, it's important not to follow the guidelines, but be careful if you to going into areas that are not familiar or not recommended by the CDC or the ADA. I work for the Minnesota Dental Association. I take their intake for peer review. So when a patient's upset at a dentist, I get the call. Very interesting. One of the calls I just got recently was a patient who said that she was going into her office and they were pumping ozone throughout the entire office, and she was afraid she was going to be poisoned by the ozone before she ever got in to get her appointment done. And I'm sure they weren't pumping ozone throughout the whole office to a level that would take care of the virus, because that would probably also do damage to people. So she had some good points, but I think she misunderstood what they were doing. So make sure you let them know what you're doing and that you follow all the latest guidelines. So let's take a look at those treatment room guidelines. The cdc.gov has got everything listed top to bottom. Please go there, and you have to visit it on a regular basis because they change. And there's not a difference between taking care of rooms for medical appointments versus dental appointments. They're all basically medical appointments. It has to do with are you dealing with droplets or are you dealing with aerosols? And droplets, most medical rooms deal with droplets. You're not creating aerosols, so you are lucky for you. You don't have to do a lot of things differently than you probably did before. Just a few little PPE items and making sure you have everything disinfected. Most dental reception and consultation rooms really can follow these protocols. Droplets don't travel very far, and so providers can typically wear surgical masks, just basic surgical masks. Check your local guidelines. But for droplet areas, for most medical rooms, you don't have to take as many precautions as the aerosols. So for PPEs, you have to wear surgical mask, and ask the patients to wear the surgical mask as well. And it's always nice to have the eye covering, and you may consider wearing gloves. That's something you can write up in your own PPE proposals for your staff. And the engineering controls basically isolate as much as possible, keep people isolated, keep people six feet apart as much as you can. Obviously, when you're doing an examination, you got to get a little closer, but just keep the isolation as much as possible. And also, clear barriers at the reception desk might be a good idea. Not everyone is doing that, but a clear barrier at the reception desk, I think, is a good sign to the patient and to your team members, your staff members. And of course, hand washing. The workplace controls would be hand washing, minimizing contact. No more handshakes. I mean, that's going to be a hard thing for everyone. We all like to shake hands, but I get that elbow bumps don't really quite do the same thing, but maybe we're going to be doing that. And of course, make sure you're wearing those appropriate PPE. Aerosols. Most dental offices produce aerosols, and almost every procedure produces some sort of aerosols, because we also use the water spray, which produces aerosols. So we have to take, as a dentist, we have to take more precautions and be more careful. And this is an area that's kind of new for all of us. And so we've got to, again, follow the CDC guidelines as they continue to change, and hopefully we can manage that. And our team members are also expecting this. They are very, very nervous about coming back to work. And so we really need to make sure we're doing everything we can, follow all the CDC guidelines. Be careful if you're asked to do things beyond that. Make sure it's something that you want to do, and make sure it's safe for the patients. So with aerosols, a PPE are N95 respirator masks and face coverings. Make sure your face is covered. Gowns and gloves should be used when you're entering a room with PPE. The hair and foot coverings right now is to be considered, not something that's mandatory, but it's a good thing to consider. Engineering controls, make sure you have the clear barriers. The open concept probably is something you need to rethink. Maybe put some barriers up, or have patients spread out so that you don't have one patient very close to the other, which sometimes we do in dentistry, especially in pediatric offices and orthodontic offices. And the workplace controls, make sure, absolutely critical. And this is also for the droplets, but make sure you're wiping down every surface that you can, and get rid of all the magazines, get rid of anything, the pamphlets that you can, and wipe down every single surface, including the doorknobs. Patients are watching. Hillary had a client that was visiting a dentist that never was not a patient of record, and he was doing an emergency for her, did a nice job. She wasn't worried about the treatment, but she ended up writing like an 8-point complaint to the Minnesota Board of Dentistry because she didn't feel like he was wiping down the doorknobs, or that the person at the front had a mask and took the mask off for a minute while she was on the phone. So they are watching, and we just need to make sure that they see what we're doing and that you tell them what they're doing. So you just kind of don't let them have that. Don't let that anxiety fester, because that's when you get into trouble. The good news, again, is most PPEs now are developing, the industry is developing, decrease in demand. One of the areas that's a little more difficult because we can't make it domestically, we're more limited in how we can make those things, and that is the gowns. The disposable gowns are harder to make, so you're going to limit those to certain areas of the world where we don't have access to. And so you might want to think about wearing disposable gowns. When I was in my little COVID adventure where I went to 3 hospitals, one of them, the hospital that was in Duluth, Minnesota, everything they had basically that could be reused was reused. They had the old surgical gowns that they were reusing. They had the big plastic respirator mask that they were reusing, and they weren't worried about PPE. And this was in the height of the COVID hill in Minnesota, and they had everything under control because they had so many reusable items. So you want to consider that they had a good laundry they could wash all those things. And make sure, again, that you explain what you're doing to the patient, and you show them this is what we do to prepare the room for you. Tell them that, and then do you have any questions? Make sure you don't cut off any questions for patients. They're anxious, they're worried. They need to know that you're listening to them and you care. And again, don't forget the doorknobs. Now let's talk about the checkout, or really what I think is preparing for the return of the patient. For dentists, we typically do have a more formalized checkout procedure, I think, than at least the medical visits that I've participated in. So, but I think saying goodbye to the patient is extremely important. Don't just let the patient walk out the door and leave. Say goodbye to them in some way, no matter who it is on your team. Make sure that they feel that they have been there, that they've felt welcome, that you're glad they're here. You want to welcome their return, and they know what the next step is, what their next appointment is, or if they don't have anything scheduled, say, oh, if you have anything else that you need, please know that we're here for you. And when you're discussing financial concerns right now, be a little more generous than probably you were before, because patients their funds are tight right now, and this is a good time for you to show some generosity if you have a chance. The most important thing you can do with your patients before you leave is to build trust. And the best book I've ever read on that subject is The Trust Edge by David Horsager. I would just recommend you go out and buy that book. I have no financial concerns with this, but it was the best book because it divides trust into pillars, and I love pillars. I love individual things, so I can kind of quantify them. And I think most of us like to quantify things. So he breaks trust into 8 pillars. And when you're dealing with a patient, think about this as you deal with a patient. People trust those who show clarity, which means that they're clear and not ambiguous. Make sure they know exactly what the treatment's going to be and how it's going to be performed and how much time it's going to take. Make sure your patients know that. That will build trust. Make sure you show compassion. And we talked a little bit about that before, about greeting them with a smile, listening to them, letting them know you care about them. Show character. They'll notice little things that are done right. Give them a little break, maybe financially during this time. Show compassion, show character to them. Competency, of course, make sure you're staying up to date on all your techniques and that your equipment is modern. Commitment, people believe and trust those who stand through adversity, and we're standing through adversity right now. So make sure that they know that you're coming out on the other side and everything's going to be fine. Contribution, people want to deal with people who have results. So make sure you're keeping those patients educated in the results, how their treatment is going. This is where you were then, this is where you are now, this is where we're going to go. And consistency. And this is probably one of the most important ones that I'd really like to talk for just a few minutes about, and that is consistency. Patients can go through a treatment appointment and have everything go beautifully. The treatment is great, everything goes beautifully, and they leave and they go to the front desk and they're making their next appointment, and something happens, whether there's some control issues at the front or somebody asks them too loudly about the financial considerations. Something happens at the front of one of those maybe 10 steps of the appointment, and one goes wrong. And the important thing about building trust is you need all 8 pillars to build trust. But if you lose just one, the trust goes away and you have to build it back up again. And trust is your most important clinical asset, especially right now, because patients are not only trusting you to provide the treatment that they're in your office for, they're trusting you to protect their physical health. They're trusting you to prevent them from catching a deadly virus by not following all the rules and regulations in your office. So you need to be trustworthy. It's also important for your team members. Your team members need to know that you're going to do everything you can and follow all the regulations to keep them safe. So building trust is absolutely one of the most important things that you can do. So, and all of the things that we're talking about, it's important, even though we have a lot of rules and regulations and ideas now, you really need to follow some of those guidelines that the CDC says. Follow all of them, because that will protect you too from your patients. But use your professional judgment based on science and depend on reliable sources, because this is going to change and you're going to have to go and visit different groups and different organizations to find your way through this. But go to the organizations that you can trust, the CDC, the American Dental Association, American Medical Association, OSHA. Go to those sources, and certainly, of course, your boards, your local medical and dental boards, and do what they tell you to do. And that will keep you safe. It'll keep you away from being the lawyers that were getting involved here. And most importantly, it'll keep your patients safe as well. This is one of those times that we're going to face, and I've never been through anything like this in my life. We went through the AIDS epidemic and thought that was hard. This is much harder, of course, as you know. And this is our time for us to stand up. We are the leaders of our offices. People are looking to us for leadership, so we have to lead. We can't give this to somebody else. We have to lead our way through this crisis. And when we get through this, you're going to be better prepared and stronger so that you can triumph over your next challenge. So thank you so much. We really are just grateful to have been here. Thanks so much. And I'll turn this back over to you, David.